we'll have some reports as we go along too, but the majority of our time is going to be related to our presenters, Gene Morrell, Bob Kuhn, and Kurt Warner, and we're glad to have Bill with us today. Bill Warner, thank you for being here. And let's stand. We'll do the pledge and then get into our meeting. It's nice to have the mayor with us. Let's see where you're. No. Joe, would you, would you lead us in the pledge, please?
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you, Mayor. We have several members that have indicated that they won't be here because they're at a meeting that Bob Kuhn attended and will be leaving to go back to, a water forum, and it's an important issue for people involved, and I appreciate the mayor being here. I know Judy is at that water forum, and we have some of our representatives that are at the water forum as well. But I'm going to turn the meeting over to Gene, who has done a lot of work on this. If he wants us to bring something up, or you have some questions that we can answer from the websites, why we'll go to that. But you're on.
Wow, that was quick. Thank you. My name's Gene Morrell, and I own a business in town, and this is kind of new to everybody, and the more people you talk to, the more you find out the confusion there is. The Health Care Reform Act, Obamacare, Covered California, the marketplace are some of the terms you're going to hear about this. I'm not an expert by any means, but I've spent about 4 months going to seminars, researching. I'm mainly interested because I'm a small business owner. I have 10 employees and just wondering what the heck to do like most everybody else. So I will mainly be presenting on a small business aspect. I know Bob and Bill and Kurt will have, they're insurance people, so they may or may not, I don't know, it's kind of iffy with Bob sometimes, whether he has information or not.
This isn't insurance, by the way.
I understand. But I'm by no means an expert on this. Most of what I have is from my opinion and what I have found, and then I'll give you what I'm going to do for my company, and we can have some discussion on that. It seems like the bigger companies have more horsepower. Between the bigger companies, Congress, and the unions, they're finding creative ways not to participate or participate in different ways, which angers me a little. A quick overview, this has already been in place since 2010. 2010, you could add children 26 or younger to your policy. I think we all knew that. That's part of Obamacare. It ended the lifetime limits on policies. In 2011, they added insurance companies must justify a 10% rate hike, and they must spend 80% of the dollars on health care, and the excess needs to be refunded to us. And I've got $26 refunds because my health care company overspent the threshold. So it's kind of a more paperwork, more of a pain, because all your employees get a notice saying that the insurance company overpaid, they're getting money back, and it's like $5 or $10. It's really crazy. And in 2013, people making over $200,000, a single person, added 0.9 surcharge to the 1.45 Medicare tax, and 3.8% Medicare tax on investment income, capital gains, dividends, annuities, royalties, that kind of thing. So that's why you saw 2013 at the end, a lot of people, or the 2012, right before this came in, people were moving money around to save the 3.8% tax. And here we are, January 2014, the exchange marketplace opens for business. Right now you can look, coveredcalifornia.com is the website. You can get a lot of information on, I didn't go past, well, I'll go to 215. But anyways, individuals must have insurance or you pay a fine. And at the end of 2014, it starts off at $95 or 1% of your income capped at $325. A lot of people didn't know that. That only comes out of your income tax. They're not gonna send a tax collector, bill collector if you don't pay the tax or you don't have insurance, but they are gonna take it directly out of your refund for your taxes if you don't have health insurance for 2014. Bigger companies must pay a $2,000 fine for every for every employee they don't have health care coverage on. The first 30 people are exempt, and that's for companies over 50. Insurance companies are barred from denying or charging higher premiums for individuals with pre-existing conditions where you live, all that. So, and again, from the doctors I've talked to, that's kind of an iffy thing as well, people with pre-existing. It'll be interesting to see how it all plays out. The 3-year fee hopes to raise, hopes is the key word, $25 billion for the program. That's the fee of people not paying insurance. So we'll see if that all comes to fruition or not. 2015, the penalty increases to $325 or 2% of your income, capped at $925. Doctors' income to be based on quality rather than quantity of care. So I don't know how the heck they're going to measure that. And so that's going to be interesting. And then I just stopped at 2016. Is the last year of the penalties is $695 per year or 2.5%, capped at $2,085. So if you're getting a big income tax refund in 2016, you don't have health care, you might be missing $2,000 of your refund. So it is something. There's 4 basic plans, which is the bronze, which covers 60%, and it has really questionable higher deductibles. The silver, 70%, the gold, 80%, the platinum, 90%. The plans actually don't look too bad if they're going to do what they say they're going to do, but again, we don't know that. The doctors I talked to are struggling with the payment percentage. It started off at 140% of Medicare, and now it's down to 60%. Is there, you know, when they first started talking. So a lot of doctors, people are not going to accept some of these plans, especially the 60%. It's going to be real limited on who you could see, the doctor network, kind of like a HMO type of thing. So you really want to be careful if you get into the lower level plans, what places are going to take these insurances. So, and then I'm just going to go in for the small businesses, which is me and a lot of us in town. From what I heard, the first, you're supposed to have what's called a model notice to all employees, whether you have offer health insurance or not. Now, I've been told that's maybe I did it. It's just a notice telling your employees how to go to Covered California, a little bit of information. I don't think it's a bad thing. And the questions I had for myself is why I did all this research is, do I want to keep my existing group, or do I want to disband it, have everybody go to Covered California and let them be on their own? So I did some research, and the other question is, the big key, and I talked to these guys over here, is right now you have the choice, unless you're Kaiser, to, my renewal date is April. So that means I don't have to worry about Obamacare until April of 2014 when I renew. So what my insurance company is offering, move the renewal to December 1st, then I have a whole year before I have to renew my policy. I don't have to worry about Obamacare. I can see if it's going to blow up, if it's going to work, if it's going to be good. So for small businesses, if you haven't done so, you may check with your insurance company and move your renewal date. That's what I'm going to end up doing after all the research I've done, is I'm going to move my renewal date to December 1st. I have the whole year to watch, listen, do research, and I think it's a good business move. As far as the plan I have is with HealthNet, and I've checked. 8 of my staff make too much money to have any subsidy, so it really won't benefit them. And the plan I have is actually for myself. I did myself, my age, my 2 dependents. I have a PPO plan that costs about $1,000 a month right now. Through Covered California, the bronze plan, which is the lower level plan, is $826 to $927, depending on which carrier. The silver plan would be $985 to $1131. The gold plan would be $1,100 to $1,325. And the best plan, the platinum plan, would be $1,200 to $1,500. So it wouldn't save me any money whatsoever, and it's a very comparable PPO, it's a very good plan. So, yes.
What about Kaiser? How are they different?
I didn't research Kaiser because usually in my experience for my group, Kaiser has been higher. So I apologize, you know, this is all about me, of course. So.
It's okay, Gene.
And so all I know is if you have Kaiser and you haven't signed a letter of intent by 2 days ago that you're gonna extend your plan, or you're thinking about extending your plan, you cannot extend your plan.
Wow.
So if you got Kaiser, your renewal date now is your renewal date next year, so. And so let's see here. I checked 2 of my staff members on my plan could save probably $150. There's a calculator on here you can punch in and kind of play around with it. And 2 of my staff members could save a little money, but for the difference in coverage, it probably wouldn't be worth it. The danger of people leaving your group is when you renew, if you don't have that 75% threshold, you can't have a group. So you gotta be really careful who jumps off of your plan and who doesn't. From what I understand, and these guys could probably help me out a little bit, if you have a qualifying plan, they cannot go to covered California unless they can save money. So 8 of my staff couldn't go if they wanted to because I already have a qualified good plan. So it's still really iffy on a lot of this stuff. So before you make a move, I'd recommend doing some research or talking to your insurance carrier. So I'm still a little chicken to jump onto this yet because government-sponsored things usually don't work out real well. It's kind of like buying the first model year of a car. There's a lot of things that have to be worked out before
The man who takes care of cars is telling us.
Right.
Okay.
So I'm not real thrilled about jumping on. So I'm excited to be able to wait a year to see how it all plays out, to see the good, the bad, and the ugly. I mean, it actually doesn't look like a horrible thing, other than all of us business owners that make a little bit of money get to pay for it. And that brings me to my last point is, since Daniel's the only one here, I'm going to pick on you.
We have.
Oh, I'm sorry, yeah.
From,
I forgot, you don't show up all the time, I apologize. On you two guys real quick.
That wasn't picking on you when he says you never had.
Yeah.
He hasn't started picking on me.
No, you've been here, and I'm sorry, I haven't got to meet you because you're outside of the district I'm in, so I haven't had a chance to sit with you. But I'm assuming that who you work for is in favor of this plan, correct?
Yeah, I'd say we've been consulting with Covered California to understand all the different.
But I mean,
facts and things that are-
you vote for it, she's all on
Well,
board.
there was a federal issue that it came out from the.
I understand.
Sorry, no, sorry.
But right now, I mean,
It's being implemented in California, yes, and we do want to.
and you're for it,
Yes.
I mean, yours, yes, okay, and I'm assuming you are as well. Because here's the pain that I have, and I'm gonna put a little on you, and I'm gonna task you to come back next month with maybe some information. Because I've done a lot of research, and everybody is misinformed on the legislators passed a bill to exempt them from Obamacare. And that is not true. They tried, and everybody believes that happened, but what they did is, what they're good at is the end around game. Okay, the Affordable Health Care Act, Section 1312 requires all of Congress and their staffers to enroll in Obamacare. They're gonna get rid of their plan, the federal plan is going away, okay? The bad news for the legislators is the old plan, they got 75% of it was picked up by the government. With Obamacare, they're not allowed to do that because you can only have subsidies if you fall under the threshold of a certain dollar amount, which $170,000 that these guys make does not qualify. So all of a sudden, they're losing thousands of dollars worth of subsidies. So what they did is cried and moaned, or I'm sorry, I'm a little biased, but they end rounded us and somehow got and I'm not clear because I've been reading this for days trying to figure out how they did it. But they've got the 75% subsidy back. So they are going on to Obamacare, but they're getting subsidized when they're not allowed to by the law. And
I believe the
again,
president gave them a
a special exemption.
special exemption.
Well, that's what I read, and I haven't been able to see what number, if it's just a backdoor deal. So if they get 75%, I want my 75%. Because the law says, section 1312, that they're no different than us, and they gotta feel the pain just like we do. If I gotta feel the pain, they're gonna feel the pain one way or the other. That makes sense? Okay? So,
Jean, could you, for me, I don't know, who is it you represent?
Congressman Napolitano.
on the other side of the Charter Oak kinda area. of Glendora.
South of the freeway.
Yeah, south of the freeway.
Carol.
And I apologize, I know who you are, and I just haven't done that. So, I mean, and they're guessing it's gonna cost taxpayers $55 million a year because Congress wants to have their 75% coverage on their health care. But they're gonna be on the Obamacare plan, just like most of us will be eventually, so. They are not exempt from it. Somehow, they got an exemption from the president to pay for that, so. That's about all I have. I have a lot of junk. If you're interested to look and read, I'll be happy. And I forwarded it to Cliff, and if you're
Okay.
interested, then, Cliff can forward it to you. But that's my take as a small business owner, which I think most of us are in Glendora and around. And I won't claim to be an expert, but I put a lot of effort and time, and I think I'm pretty knowledgeable on this. So these guys,
No, we're not.
we were talking the other day, we spent, an hour almost, it seemed
Right.
like, and the two of us still couldn't figure out what the heck is going on, so. But anyways, if you have any questions, or these guys will be up now, and they can say what they want to say.
Okay, let me just start by saying, my name, for those of you that don't know, is Bob Kuhn. I'm with Allendale Insurance. Bill and Kurt Warner are with Warner Insurance here in Glendora. My specialty is not health insurance and or life insurance. In fact, when I have a client, I usually send it to Bill. I shouldn't say it, I send the person to Bill. I trust that they really do a good job for their clients and they know what they're doing. It's been fairly easy in the past because we've all known what the rules are. Obamacare, or the Affordable Care Act, which it should become the name of it eventually, might scare people at first. And it is an attempt to do a good thing for an awful lot of people. The problem is, in my opinion, and for the next 2 minutes or 3 minutes, I'll give you my opinion. In my opinion, they're trying to do too much too early. And so there are gonna be a lot of questions, there's gonna be a lot of problems, it's gonna be fraught with problems. And the naysayers, the half-full people, glass half full, are gonna look at it and say, oh, hell, it's not gonna work. That isn't necessarily the case. I'm assuming, like everything else, the intention is right, and there will be a lot of changes that come through in the next 6 months to a year, probably over the lifetime of this bill. But 20 years from now, people will not know what it's like in the United States to be without it. So we just happen to be the test case. It's gonna take time, it's gonna take patience. The problem, one issue that I have is it is not. And anybody in this room that hears this from now on, the word insurance, please understand this is not insurance. Insurance is when you buy something to protect you from the unknown. Healthcare is not an unknown. Everybody in this room at some point is gonna go to the doctor, and everybody in this room is gonna use this product. It is not insurance. So it's a matter of how do you get enough people to pay a premium, a number, so that those that are using it can have their bills taken care of. And until they get young people to really buy into this, and I don't expect that to happen for the next 3 or 4 or 5 years, as Jean explained, the fine for not carrying it right now is gonna be very minimal. for a guy like me, I'm 69 years old. I've had heart bypass surgery, I've had my shoulders operated on, I've had my wrists operated on, but why would I buy insurance today and pay the kind of premium that he's talking about if I can buy the policy 6 months from now when I'm diagnosed with a disease and there's no pre-existing condition? That's the problem I'm having dealing with this issue. I just don't see what the hook is yet to get people to buy it if there's no such thing as a pre-existing condition. No reason to buy it. I'll buy it when I need it, and then it's not insurance. So that's what I'm trying to say when I say it's not insurance. Congress is going to have to fix that. And where I do share with Gene is it's very difficult. Government is trying to take over something that has been really well run if you look at it over the last 100 years. Maybe not affordable for everybody, but this isn't going to be affordable for everybody either. So it's just going to be mandated that they're going to have to take it. And eventually those fines that he's talking about, when you look at the year 2020, are going to be up in the $1,000 range. And then it's going to become, do I pay for the premium or do I pay the fine kind of thing. So there's a lot of tweaking that's going to go on. Don't get nervous. Don't be afraid. Just deal with it as we deal with it, and we'll try and stay informed as much as we can. I hope, I'm going to say as insurance agents, we're going to be authorized to help people, but we have to go through a special training also that they also haven't outlined quite yet as to what we have to go through. So we really can't help you yet. But I hope eventually they will have, whether it's me, these two gentlemen to my left, or anybody else, I hope people will be there that can help us. Because right now, I'm not tech savvy, so when I go onto the computer like Gene does, I'm a dead duck. I just don't go to the next click like I should. And that's what scares me more than anything else. I want to be able to go in and do what I do with Bill right now, and that's sit down with him, have him explain to me what we're doing, have him help me fill out the app, and help me move me on to what'll be a smooth transition. And I don't think we can do that. Now, you can speak to that yourselves, but I don't think we can do that just yet. So all we can do is help you with the bumps in the road that we see, and we'll all learn together, I guess, is the best way. The notice that Gene said needed to be sent out, I do have a copy if anybody wants it. I can either provide this one for you. This was sent from Three Valleys Municipal Water District, which has 20 employees. There are
It's on the chamber website,
And it is, I was gonna say.
both the yes and the no.
Okay, and that's important, because theoretically you do, as an employer, even if you only have one employee, you do have to notify them. And where this is gonna kick in is, it's gonna be issued through the businesses. If we have 50 or more employees, it's gonna be mandatory. If employees work over 30 hours, they're gonna have to buy it, or the business is gonna buy it. And then I guess you still have the right to deduct it. But what's happening in my world, and I call on all of you as an insurance agent, a lot of people are no longer hiring 40-hour employees anymore. I would guess that the city of Glendora will, probably a year or two from now, they're not gonna do it today, but I will bet you that all municipalities, certainly the water districts, are gonna do it. We're not gonna hire 40-hour employees anymore. The work week will be 30 hours. We'll hire more people than we will less, and it's just one of those things we'll be able to get without, or do without. And then eventually Congress will kick it down to 20 hours, or they'll try and keep forcing us to buy it. And I hope people do buy it. I hope people do investigate it, and I hope people do invest in it. But I can tell you right now, I've got several contractors that are no longer hiring. If you go to work for them today, they tell you it's gonna be a 28-hour work week. And we're hiring 2 employees instead
Well,
of 3.
it was my understanding that it's the equivalent of, so if you had 2 employees at 20 hours, that equates to 1 40-hour employee, is that correct? Okay.
That's one full-time, and that's a true statement. But nobody knows exactly how they're gonna interpret that yet.
That's a true statement, but then what happens is that employee is still a part-time employee.
So he has to
And the
buy it
law-
on his own.
And the law only is gonna apply to if you work 30 hours or more.
Okay.
So so even though the company has, 100 equivalent employees, it's still, if that employee's not working at least 30 hours,
They're still
not
part-time.
mandated to provide coverage.
But they will have to buy it out on their own, and then that's when you do have to, I'm assuming you'll have to negotiate something with.
And you can almost get it for free if you're working that low a dollar amount. I mean,
I'm not
it's-
gonna have to worry about it.
No, I
I'm
understand,
so
but I mean,
small, but
that's what's nice
that
for
was my
the
understanding as
people
I
that
read it.
are working very little hours, making very little money, the subsidies are very good.
Those are the tugs and pulls that I see in the future that we're gonna have to learn to deal with, and certainly Congress is gonna have to deal with them. My other problem is, and I feel free to say it with representatives sitting here, I respect the job they do, but I do not think that they work for you and I as individuals. I do think they work for their party leadership, and that's a resentment that I personally hold. I hope not all of you feel that in the future. I wish they did work for the people. They come out and give their speeches that they represent us because we vote for them and we elect them. But when they go back and do what they're doing right now, why aren't they fixing their problem? Why are they doing what their party leadership says? That's just hard for me to understand. They need to do a better job of explaining it to us, the people. So I'm not sure that they're really there doing the best they can for us. I think they're doing what they have to do to survive in their own work world too. So that's my only negative. Other than that, I hope this is a positive experience for all of us. I think it is something that's time has come. I don't know that it's come in the format that it's here in, but I don't think the format that it's in today is going to be very long. So with that, I'll let Bill start and then Kurt, but I think really what we need to do is try and answer any of your questions like Carol had.
Right, and really, you guys did a great job of explaining how it's gonna be, and if we could just open up to questions. Basically, I guess how we'd set it up is, this is a new car hitting the road, and do you guys have questions about who's affected here in 2014, and how you're personally affected, how your business is affected, what will happen here in the next couple months? There will be some changes for large groups of people. There won't be any changes for other large groups of people. And we'd love to answer your questions based upon that.
What we know today. Yeah, please, Joe.
I just have one question. Our nonprofit has one employee. So Bobby mentioned that we have to do a notification to them, and is there a timetable that has to be completed by?
2 days ago.
Well, as I understand it, October 1st, but I think if you get it out, I don't think anybody's gonna say anything one way or the other. And really what it is to notify them whether you carry health insurance or not, if you don't carry it, and where they can go to get it, unless you know more about it.
No, that's exactly right. At first, there was a penalty for it, and then there was a deadline for it. Now there's not a deadline for it. Basically, the reason that you need to give it to your employee, and I looked this up after I talked to you, Gene.
Because we were unclear about it.
Right, and the main reason why you need to give it to your employee is because if they do qualify for a subsidy through the California exchange, they need your employer ID number, which will be put on that form.
Right.
And that will tell the exchange whether or not they'll be able to allot them a subsidy. And and the other reason why that's there is if you are a business of 50 or more, is to tell the state or the federal government whether they should penalize you based upon what you're offering to your employee or what you're not. Yeah, you're welcome.
That brings up a little issue I had when I saw that form. And I did give mine out, and I did put my ID number on it. I had a little problem, and this is going to
Right.
the legislators, that when I start giving out my employee ID number, there's a security risk in all of that. And so I have much confidence in the couple employees I have. But at the same time, that piece of paper's floating out there with ID number on it, and I don't know where it goes after it leaves my
It's
possession.
not a comfortable feeling.
No, it is not.
That's
Not
a comment
basically
that's
your
been made
business
before.
is
social security number.
Right,
Well,
but
of
that's
course
a
somebody
comment that's
is.
been made
Yeah.
before. And
It's my
again,
IRS
it's
number.
one of those things they're gonna have to deal
Yeah.
with. Right now, unfortunately, we're stuck with what we're stuck with.
But you know, if you have, if it's your business, and even if you're a sole proprietor, it's, and then you have an employee, you do have a federal ID number.
Correct.
For payroll taxes.
Right.
So that's the number you're gonna give out.
Right.
That's not too big a deal.
They can
It's not
find
too
it
much
there.
gonna be done with that number. Okay, if it's their social security and your date of birth, that's
a big
a problem. That federal ID number, that gets mailed on 50 different forms that I can think of that just get thrown away on a regular basis, because most of us don't do our payroll anymore. We have somebody else do it, but we still get the payroll forms and we just chuck them. Well, most of the time when you chuck them, if you look on that label,
The ID
your
number's on it.
ID number's on there. So at that part, I think we're safe on that.
I have a question. Can you go back and clarify a little bit what you said? Now, I have, at this moment, 3 part-time employees. So if 2 of them work 40 hours, that means I have a full-time employee? Is that what you said?
Yeah, if 2 of them, it's what's called a full-time equivalent, that's right. So if you have two workers that are working 20 hours a week each.
Speak up just a little bit more, if you will, please.
Excuse me, if you have 2 employees that are working on a part-time basis, 20 hours a week
Or more.
you're gonna add those together. So if we add those 2 together and we've got 40 hours, that's 1 full-time employee equivalent. However, I think the thing you wanna keep in mind, the Affordable Care Act has absolutely nothing to do with employers that have 25 or less employees, other than the mandate that we just talked about, that you have to provide your employee, that whether you provide insurance or don't provide insurance, this little letter that was supposed to give an out by October 1st, you have to give that to each one of your employees. But as you as an employer, you absolutely have no responsibility at all. You're not even on the map as far as Affordable Care or Obamacare.
Yeah.
Yeah.
And that's an important thing to recognize too, who isn't affected. So if you're on Medicare, there's no transition period for you here. Nothing changes, everything's the same. If you're employed by an employer that employs over 51 or over, this year, there's no transition for you. Everything is the same. And that hopefully will give some of you some peace of mind on the next 3 months. You shouldn't be stressing over what you personally need to do or what a son or daughter or parent needs to do based upon that information. The people who will be changing are individuals, really. The whole market really will be changing. So if you purchase your insurance individually, you're most likely going to receive you're going to have to transition unless you purchase your plan. Is it 2012?
March of 2010.
Punch in,
Yeah.
this is the calculator, you put 2 in the household,
Let's say there are 2 in your household,
you make $60,000.
and you make $60,000, and the zip code is 9174.
Make it 1, they can afford it.
Yeah.
Zeros can't.
Then scroll down.
That was 0.
Put your age in there, one of them's age,
Let's say you're 58,
and then add another one,
and you add a second adult that's 55.
and
You got,
then you put see my options, because you have 2 people, right?
where?
Down to the yellow.
Oh, yeah.
And then you have to X out of this, because it'll come up every time, so there's a little X up in the.
Up in the far corner on the right.
See a little
Right.
blue X, yeah. And then this will be the cost of your payment, the total is, for LA covered care is $702 on the first one, you get a $478 subsidy, so your payment would be $224. So you would actually, save quite a bit of money in that scenario. But if you're over, I don't know, $60,000, $70,000 with one person, you won't get anything. So,
And then you have to
Silver.
look, you gotta look and see what the plan covers.
and if you scroll up a little more, Cliff, then you can.
What, this way?
Right here, see the gold platinum?
It's up on the left-hand corner.
Right underneath your options. Yeah,
Right there.
right there is the other 2 plans, those are the top tier plans. So you still get a subsidy for those plans, and it's a little more money.
But you have to make sure that you're looking at what's considered income, because it's not what you pay the income tax on. It's your income.
But that's pretty straightforward too, because basically I looked that up the other day. If you were in a situation where you had any tax-free income coming in that was taken off and you adjust the gross income, for instance, you could have, in that household, you might have tax-free Medicare income, you've got that. You might have tax-free bond income. Okay, those sorts of things that have to be added back on. But if you had income from outside the country, that has to be added back on. But pretty much, there's a few other things, but not too much. Yes, sir.
What about an individual getting veteran compensation? Would that play a role? Would that be considered what of his income, like?
If it's
Because
workers'
it's-
compensation?
Yeah, because it's tax-free from the federal government. How does that play?
Well, you know what, I'm gonna do just like my financial tax accountant does. He'd say, you know what, we're gonna look that up. I honestly don't know the answer to that completely.
I'm pretty, I don't want to give you a pretty sure. So, yeah, we'll
I mean,
get back
even
to
though
it.
they already have coverage through the VA, you know, some individuals, you know, like to have other, you know,
Definitely, for more practical care.
I
close
think
by.
once you're into one plan, you can't cross over into the other plan, but I wouldn't swear to that either, from what I remember.
Do you know if there's gonna be an open enrollment on this every year?
Yes. Every year. Let me just, that's a good question. This year, and I'll kind of backtrack here a little bit. And I think in California, we've always been a progressive state, pretty much. And because the reason I say that is, I remember back when we had Hillary Care. Remember they got on TV and they held up that card and they said, we're all gonna have this national ID card. Well, everybody in California went to work. And we ended up with some wonderful legislation for small groups under 50. That's where we got it. Before in the early 1990s, you know, if you had a small group, 4 or 5 people, you were dead in the water if you had any serious illnesses, because you were underwritten specific to that group. And what happened was you couldn't get health insurance. You really couldn't. It was a disaster. So they came up with this, the Assembly passed a bill where we could cover small groups 2 to 50. So, you know, we've always been in, our little agency's always been involved in health insurance. That's pretty much all we do. And it was you know, everybody back then said, well, hey, that's gonna be the end of the world, you know, government's taking over, we're done for. Well, the net result was, it was a wonderful thing to happen for small employers under 50, because for the first time, they could really get true pool-rated health insurance. And it really has worked quite well. And Gene will say, he's covered has a health net plan, which happens to be a very good firm, they've got very good prices, and it's worked well. Okay, so that moves us forward, and then there were still some slots, and people come along and they try to do good things, and it kind of goes wrong. Like somewhere along the line, Congress in the 80s changed the rule that if you don't have insurance and you go to a hospital, that hospital's emergency room isn't supposed to close, they have to take you. Well, it sounds like a really good thing to do, because before that, in Glendora, if you got sick and you didn't have any insurance, you went straight to LA County, or the closest trauma center that LA County had. Well, you're thinking, gee willikers, this is a great thing to do that. What happened is we had overutilization. Now, in the past, I've heard administrators tell me that in their hospital, 7 out of 10 people that come to their emergency room have no insurance at all. Well, who pays for it? Those of us that have insurance pay for it. Those of us that are property owners pay for it, basically. And it comes down to the taxpayer pays for it. So anyway, that's it. I mean, Bob mentioned that something had to be done, and I agree with him, something had to be done. But it's really, and we're in a process of change, and nobody likes change. Let's face it, I don't care who you are. kindergartner doesn't like change. He wants to keep the same schedule, do the same stuff. Well, that's not gonna happen. We're gonna have some change. But we've got an enrollment period. It goes from October 1st of this year to March 31st of next year for individuals. Okay, and that's really important. If you're an individual and you receive your insurance on an individual basis, you want to make sure you do something in that 6 months, okay? 6 months and 1 day, you're in trouble if you didn't have insurance, because you're going to have to wait to the next open enrollment period, which is going to coincide with the Medicare enrollment period, which is October 15th through December 7th. And so, you know, I think, and I really agree with what Gene says, that you have to, this is kind of going to roll out and change, and Bob said, it's going to change as we go along. But, you know, as an individual, you've got some great options here. You can, if your plan was issued before March 23rd, 2010, that's a grandfathered plan, same for small group too. And if it's still credible coverage and the price is right, you don't have to do anything. You can stay right where you're at. If the price isn't right or the plan design isn't right, you want to change. And you can change now. And you can go to any carrier through the exchange or not through the exchange, and you're going to get coverage. It's guaranteed, okay? And there's not going to be any pre-existing conditions, okay? If your coverage was issued after March 23rd, 2010, then what's going to happen is, you know, you're going to want to see, hey, you're going to have to change your plan for sure, okay? Depending on your income, whether you're going to go through the exchange or don't go through the exchange, that's, you know, but the deal is you're going to have some very good options, very affordable options to get coverage. On a small group, Gene's a textbook case, and he did it exactly right. Okay, what he did, because he knew he had some options. He could just flatly drop health insurance as his, you know, because he's not going to be able to take advantage of any tax credit. That's not going to help him.
Yeah, this really stinks. They talk about all the tax credits available. We qualify for none.
Yeah, and I haven't ever found hardly any groups that do. So we're not going to fall. So, but he did his analysis, and he said, hey, wait a minute. If we go to the exchange, we can do this. If we just keep what we've got, we can do this. And you know, for his firm, he made a decision that works for his firm. Now, other companies, they might not have the same deal. They said, well, hey, wait, you know, if we just drop coverage completely, I've got 5 employees covered under this group. If I just drop them and let them go through the exchange, they're going to get a better deal and better coverage. That's what they're going to do. But the key is they're going to be able to do it. The only big drawback I see about this, other than it's just a little bit complicated and it's taking us time to get our hands around it, is something that Mr. Kuhn mentioned, and that is there's not a big enough hook to make everybody participate, because that's why insurance works. Medicare works because everybody has to participate. And if you don't sign up for Part B when you're eligible, when you turn 65, you don't have credible coverage someplace else. If you don't sign up for your Medicare coverage, they're going to penalize you 10%. And that 10% doesn't ever go away. Okay, and it accumulates. And so that's why people, when they turn 65, they don't fool around. They get on Medicare Part B as soon as they can. And so I think if anything, we just need a bigger hook. But I think whether it's individual or group, you know, take advantage of this open window that we have right now. And each of them, you have to work with, you know, figure out what's best for you. But there are options out there that are important.
Just to add on to the open enrollment period, so individual will have October 1 to March 31. If you're in a small business, you do not have an open enrollment period. So you will have more freedom. So, you know, let's say if you miss the open enrollment, you don't have any insurance, yet you have a small business with, and you're handing out W-2s at the end of the year, you can at any time get insurance, which is an extra freedom to the small business owner, and something definitely to keep in mind. so.
As a small business, one of the only reasons I offer medical is half my staff can't qualify for it on their own. So now that's gone away, so now I don't necessarily have a big reason to keep medical as a benefit, because anybody can get it for any reason.
Yeah, and
So that's a huge option for me, because health insurance is a pain in the butt and expensive, and
Right.
nobody's happy with the plan. Now they can go get their own plan, do whatever they want, choose the coverage they want, how they get treated, the doctors they want. It's gonna be a great thing once the, Bob says the coverages come, start evening out.
We do address one issue though, and maybe Kurt and Bill also have an opinion on this. Another big problem that we've got right now is certainly if we don't in this room understand it, doctors themselves don't understand it. And doctors have been under a mandate for the last couple of years now. They've got to get rid of paper records and they've got to do everything through a computer. So as your doctor comes in with his tablet, don't be shocked and don't be afraid. He's not giving away all of your secrets. But with that said, what does bother me, I'll just say Neil Doherty, that's who I use as my cardiologist. He's afraid he's going to get an influx of new clients that he will no longer be able to afford to give the care that he's giving right now. He will only take 8 patients or 9 patients on an hourly basis. And he's telling me it looks like he might have to go to 20 patients on an hourly basis. When he walks into the examining room with me, and my wife is there with me, he'll take 10 minutes or 15 minutes to answer questions. He'll make it up somewhere else where he doesn't have all of those questions that's coming at him. He's not going to be able to do that. And that frightens me from the standpoint that I don't see how they're adding on new facilities, hospitals, for doctors for the personal care. And I think these guys are going to be overworked. Neil's other complaint is he says under this Affordable Care Act, his office visits, well now he'll get reimbursed $37 per. Right now he's getting $65 per. If that's really true at 37, I don't know where that number comes from other than from him. But if that's really true, a lot of doctors aren't going to be involved. And that bothers me. So again, it's another problem that hasn't been worked out in advance, at least to my satisfaction.
Well, I think that's a great point. There's 2 things that are going to complicate this. Like we said, the guaranteed issue, and that's going to affect costs, and then also the providers. The providers really, they're probably the biggest cost factor on prices. If I could sell the same plan, or we could sell the same plan to Glendora, next to Foothill Press, and then we'll sell it next to Cedars-Sinai. The plan next to Cedars-Sinai will cost, if it's PPO, 30 to 40% more. Why? The person's probably healthier next to Cedars-Sinai. I mean, it's, so the reason why is because the cost of that hospital. Cedars-Sinai has so much leverage. When Anthem goes to negotiate, or Blue Shield goes to negotiate, Cedars-Sinai is saying, what are you going to do without us? Anthem says, okay, we'll pay whatever you want. Foothill Press doesn't have that same leverage, so they get a cheaper price. So with this being said, the main issue is these benefits are standardized. So we have the bronze, silver, gold, and platinum. So insurance companies will have to offer plans between 58 to 62 payout, 72 to 82 payout. Platinum will be 88 to 92 payout. That's obviously before you're max out of pocket, and I'm sorry if I'm getting too complicated here, but when you can't fluctuate benefits as much, what you're going to do is you're going to really shrink provider groups. Because before, I could give you access to a huge provider group and give you very little coverage below the $6,000 deductible. But you'd be happy because you could see whoever you want and the price could be right. Now it will be harder to do that. The bronze plan does allow you to do that. The deductible is right around $45,000. Yeah, 45,000 would be tough to pass, but it's 4,500. Max out of pocket will be 6,300. So with those plans, that'll be the cheapest way to get into your largest provider groups, and that will be important when you're shopping this, because really the main thing you want access to when we're talking about this health insurance, and Bob's right, health insurance is kind of an old term now. It's more of like a health payment program. You want to make sure the card that you're holding gives you access to the doctor, to the Southern California medical system. That's the most important thing. And that you're not going to lose your house if you go there. And really, the bronze plans will probably allow you to do that at the cheapest rate. You could get the platinum, but make sure you understand what providers are available to you. There's certain companies that are allowing the PPO network to go all the way from the platinum to the bronze, and there's certain companies who aren't. So I do advise you, when you go over this, you probably should call a broker. It is a little bit bigger than an hour job. I hate to, I will promote our business in that way. You don't have to call us, but you should probably call somebody, because it is somewhat complicated. And you do want to make sure, as Bob says, seeing his doctor is critical. I mean, the guy's working on his heart. I want to know the guy working on my heart. You could sign up for a plan, and if you didn't know, check the provider list, you might not have the same guy working on your heart, okay? And that's another thing to understand with this Covered California website. This is just an avenue to get you to the company. As you go through here, there's not going to be a place here to find out specific providers. What they will do is they'll give you a phone number to an insurance company to check out their provider list. So you still will be dealing with private insurance companies, and you will have to check. And every company, the way they compete is through contracts with hospitals. So they all have different providers, and that's an important thing.
What do we have in California, 6
for the
providers
shop,
that are in this program?
in the shop, there's 6, really 4 that are only,
4 of them.
really 2 of them are regional. I think there's only 6. And notably, the ones who aren't in the shop is Anthem Blue Cross and United Healthcare. And Anthem, they insure most of California. So for them to not be in the shop, what that tells us is they don't think a lot of companies will go through the shop. Really, the only advantage of the shop is those tax.
Yeah, but Anthem, I just got mine. I'm on Medicare
Right,
with Anthem.
right. Good for you.
Our prices, we got it in the mail yesterday.
For your supplement, or well, that's good. But
And then, you know, we started with no premium.
oh, okay.
And then it was 28 this year, it's 60 something next year.
Yeah, so you have a regional PPO.
Well, so the idea, I think we support healthcare for people, but mine's going to go up to subsidize somebody else's.
Well, what's happening is that that doctor wants more money that's in the provider group with Anthem Blue Cross. That's what's happening. You're not indirectly subsidizing, not yet indirectly subsidizing under 65.
They're lowering
Not
the
yet.
payment threshold.
But the young, convinced me that the young people are going to sign up in the numbers that are projected.
They're not.
And that's how it's going to be paid, or somebody else is going to have to suck it up.
There's no reason for them to join right
Yeah,
now.
that's right.
Well,
There's
they'll-
really not.
They'll have, I'm sorry.
The other thing that you've got to look at is Bill just made a good point. $4,500 deductible. Right now, if you look at the majority of plans, are either $1,000 or $2,000 deductible. Some are $500. Some, I'm sure there's still a few around for $100, but very few. But all of a sudden, with a $4,500 deductible, theoretically, your premium ought to be a heck of a lot less. Because you're going to take care of most of your problems yourself.
Right.
So,
Yeah, in this, there's, on all of these, that when you go through that first thing that we looked at, there's either $4,500 or $6,700
$6,000.
Out of pocket
Max
before.
out of pocket.
That's maximum per year.
Yeah.
That's pretty standard to what's available, you know.
That's pretty standard what's out there now.
And that's really the most important number. If I go to City of Hope and I want their services, what's the most they're gonna take from me? And what they're saying is $6,350. So that's pretty, you know, that's pretty standard for individual policies.
See, I'm kind of like you, Cliff. I'm sitting here thinking about young people, and they're looking at it going, you know what, I can barely afford the $150 a month, let alone the $6,000, you know, so they're just gonna pay the $95.
Or maybe
That's
there'll be
like
a cultural change and people say,
Right.
you know, I don't have to have the new pair of jeans, I'll actually be a responsible citizen even though, you know, I might have 10 degrees.
Oh, we
and I'm
pray
Do
for
it like
those
the
days.
Coast Salon,
You know, and maybe there will be a stigma when you can't get it after, you know, let's say after March 31st hits, you're at the doctor and it's May, the doctor's not gonna have the same conversation with you. He's gonna say, you know, I'm paying for you to sign up on this. What'd you do? You didn't sign up for this, now I'm not gonna get paid for treating you. Should I do my job for free? You know, or should everybody else have to pay for you? Maybe those discussions will start to happen, you know.
You know, you said, this brings up a real good point that I think wasn't really addressed well with the Affordable Care Act. And that's actually somehow getting a hold of the cost of providing the service. Whether we want to recognize it or not, in this last decade, from 2000, 2010, the increase in just actual cost of providing the service has been well over 10% per year. And as you know, we went through the, in 2008, we had a big downturn. You would think, well, hey, maybe the medical, that's gonna be part of the downturn. No, it's not. It's the exact opposite. All the rest of us were going down, medical was going up, 10, 12, or 15%. And I have to say, the insurance companies aren't perfect. But I was really amazed with, because part of this this Affordable Care Act is, they have to spend either 85% or 80% on benefits over $1. And you know what? All of them have been pretty close. Some of them have been over, have actually paid more. One year, actually, Blue Cross actually had more. This last year, they missed it by 0.5%. They're like 79.5%. And so we have to consider the cost. And I'll just give you an example, because this just happened to us last week. We had a young man, 45 years old, picture of health, well, spent 1 week in the hospital in intensive care. His bill was $223,000. That's his adjusted bill. That's what the insurance company is going to pay off of. So there's real costs involved here when we talk about health insurance. And so if you factor that in to somebody, there's so many things that we could talk about. But I think the key is for you as individuals and small business people is to look to see what gives you the best coverage for the least dollar with the provider that you can live with. If you do that, and you've got 6 months to do it, and I think Gene brought up a wonderful point, and that's true, we deal with a lot of small groups, and the reason why they have small group health insurance is because they've had some real insurable interests or problems. And now, that employee who through no fault of his own was born with childhood onset diabetes type 1, he doesn't have to live scared anymore. He or she can go get insurance and not be afraid of having to pay 175% more or decline. And so there's some positives here.
Sorry,
This guy has to get his wife to the airport on time.
Thank you very much for being here.
Thanks.
All right, guys.
Now you're in trouble, you got the two old guys left.
Thanks for not including me in that.
You made a mistake.
Additional questions, I think the issue is that nobody knows for sure on some of this stuff, a lot of this stuff. Probably a good idea to get on this website and play with it. And
Maybe not for a week or two until
Yeah,
we
I'd
get the
wait,
bugs
yeah.
worked out. Right now, I don't know that I'd want to be the first on.
no, I didn't say sign up.
Yeah, no, but even to play with it, you're lucky that you're able to do it today. With the number of people that are doing exactly that. a
Well,
lot of
okay,
the
from that
servers are
standpoint,
crashing.
yes.
So,
My point, if you wanted to do that, I'd do it early. It's like if you're an early riser.
Right.
If
Yeah.
it's at 7 o'clock, you might want to do that. But, kind of pick a time where you think most people are not going to be on the system. And then I've noticed just ourselves personally, we get a little better results if we start early.
Yeah.
it is an Eastern Coast time.
What?
The reality of that program right there is Eastern Coast, East Coast.
Yes.
Don't ask me why, it's California. I do
Okay,
think so.
are there other questions you want to fire right now, and we'll move on?
For when you're figuring out your quote,
Yes.
is that figured by net or gross income? If you're looking at it as an individual?
It's gonna be, an individual, it's gonna be, basically, it's gonna be your adjusted gross income. So it's not your gross income, it's your adjusted gross income. And I forget which exact line that is, but then, as Mr. Hamlo brought up, you have to modify that under certain examples. And when you look on the website under Covered California, it only gave us a couple different, when you click on the question, it tells you, you have to add in, like, for instance, if you own municipal bonds, you don't have to pay taxes on that. That's subtracted out down at the bottom, so you have to add that back into that adjusted. And basically, any tax-free income you have to add back in, and that's the figure that you use. Or, that's a good question, because you can actually, my understanding, the training I went through, that you can project it. We give an example. Let's say you're a realtor, okay? Realtors have good years and bad years, okay? So if you know that you have you're not thinking you're gonna have a real good year next year, and say maybe this year you made $60,000, but you know next year you're gonna take most of the time off, and you haven't got much going on, you can estimate a lower income. Now what's gonna happen is you're gonna get a subsidy, and you have two choices with that subsidy. You're going to be able to take the subsidy as you pay your premium through the year, or you can elect to take it as a direct tax credit on your tax return for 2015. So what we kind of been instructed to do is to tell people you kind of want to overestimate your income a little bit. And the reason why you want to do that is because that way, if you get to 2015 and you file your taxes, because let's say you underestimate your income, you file your taxes in 2015, you're gonna have to pick up the difference of that subsidy that
You're gonna get a penalty.
Yeah.
Well, it's not a penalty, you're just gonna have to pay, it's not a penalty, except, like, if my income is gonna be 100,000, and I applied online, someone will make 60. Well, at the end of the year, 2,000, and I got a subsidy based on that. So my insurance was supposed to be $500 a month.
You have to
I
give
only
that
paid
subsidy
$400.
back.
Yeah, so I'd have to give that
Pay that back.
because I should have been paying it all along. But it's better to know that upfront. So I kind of encourage people to kind of overestimate your income. That way, if anything, you'll get a little bit of a credit back at the end of the year instead of having to pay the IRS anymore.
Okay, we have until, you said March 1st, is it?
March 31st.
March 31st. So maybe the three of you, four of you, in January could come back and kind of readdress where we are and how the landscape has changed and things like that. Because we appreciate very much the information you've given today. And as information comes available, we'll try to get stuff out to you. There is one that the Kaiser put out that talks about but this is early on, and but it at least gives you ideas of what's happening and how we're going to be able to address or not address what we're going to have to do as individuals as well as businesses. So
Let me leave one last point.
Yeah.
That's the people signing up today that are actually signing up. That's with an effective date of January 1st, 2014. They're not signing up effective today.
That's correct. And there's another good point to bring up there, and that is if you sign up by the 15th of the month, so if you sign up by December 15th, your coverage is going to be effective January 1st. If you sign up on December 16th, your coverage is not going to be effective to January 1st. So if you're trying to get the next month's coverage, You want to do it between the 1st and the 15th during this open enrollment period.
Good. Thank you, and thank you, Bob. I know you left the meeting to come, and do appreciate it. Gene, you've kept us in tune as we've gone along as well. And Bill, thank you very much, and we will have you folks back, I think, at a future meeting after things have fluttered out through the workplace. Quickly, Daniel, do you have anything you want to?
Just a few quick things. I shared with most of you our legislative bills that have passed both houses and that were signed by the governor before, but one I want to share is SB 416 was signed by the governor. That has to deal with some Caltrans owned property along this proposed 710 route that would never took place. So SB 416 was co-authored with Senator Holden and Gatto, and essentially that bill helps expedite the sale of some Caltrans owned homes along the 710 route on the west side of our district. Then Senator Liu will be hosting a community schools bus tour October 14th through the 16th. That's to highlight the community schools strategy. Again, community schools is not a program, but it's a strategy where community resources are better aligned to help support student success. And on this bus tour, we have invited different educational stakeholders such as First Five California, the California School Administrators Association, and so on and so forth. And they'll be joining us as we stop at different community school sites across California. And we're going to end with a Senate hearing on October 16th at the State Senate Education Committee. You're all invited if you'd like to see.
If you'll send that to me, I'll get it out to them.
Sure, I'll send some
Get that
information over. It's going to kick off October 14th at Madison Elementary in Pasadena at 9:30, so I can send you more information, Cliff. And then in order to better understand our local business climate, Senator Liu is going to be visiting Claremont and doing a business walk there on October the 18th. And she'll be meeting with local leaders and also speaking with the small business owners there as well. And then also Dr. Vorsenberg will be hosting a superintendent roundtable to follow up some discussions that we've had with our superintendents in the past. And that's going to be October 11th. And then finally, October 17th, we're going to be hosting an emergency preparedness event in Glendale. And more information I can share with you as it comes about if you're interested. That's it.
Good. Thank you. And Adam, nice to have you with us.
This is my colleague Adam Carter from the office as well.
Good.
I just joined Daniel because I knew the discussion was going to center around the Affordable Care Act and on the Senator's Health Deputy, so there
Great.
are questions, but I don't have an update anymore.
Who's
Okay, you
left
can
in
bring
the
back
office?
why they're getting the.
Who's left in the office? We got all your staff out at the water department.
Talk to our venerable Vickery.
Chris, nice to have you here. Do you have anything you'd like to add?
Even though we're in the middle of a shutdown, our office is still open, providing with services that are much needed in the community. Still trying to wrap my mind around, everything that's going on with the Affordable Health Care Act, and if you have any questions, feel free to give me a call in my office or reach out to any one of my colleagues, and we'll try our best to help you with your questions.
Good. And Chris's email address is on the information that I send you with this information, so you can contact him as well as Daniel or Enrique, who told me that he wasn't going to be here because he's at the water place, and so is Claudia from Assemblymember Hernandez's office. Judy Nelson is there as well. Mr. Mayor, do you have something?
I'm not sure if Judy talked to you about the water issue. We had a meeting with Judy Chu last month. Did she bring that up this month?
Rivers.
Yeah, the
Yes,
river, she did.
I won't go back over that unless you want me to.
Well, very quickly, let me add, Joe, the COG did take a support position of the concept. We haven't seen the written language yet. And the COG is doing that in conjunction with the water agencies that are also supporting that concept. But they're not going to support it, the water agencies. And I'm assuming the COG will not support it if it gets into the wild and scenic rivers.
Okay.
We've said it as politely as we can in every form and language we have that we know of to Judy, saying, please separate these two bills. Do one. If you want to do the other some other time, that's fine. But right now, we can't support that, and the water industry won't. That's unequivocal. So,
That's the same position the city has. And we actually, when we talked to Judy, we had mentioned to her, you know, this is a two-part issue. The first part, it seems that there's no problem with the first part. People are going to take a look at it and work with you on it. The second part about
Wild and Scenic.
yeah, is a huge issue that's not acceptable to anybody. And we suggested that she split the bill or the legislation and say, move forward with that and build your base and let people get comfortable with it.
Exactly.
And then come back and it gives you time to get some legislation out there, and then it gives you time to take a look at this issue that everybody's so concerned about, and then work with the stakeholders and find out what you can resolve, instead of throwing it all into the same bucket and trying to push it through everybody and down everybody's throat. And you know, she's very gracious and she's a listener, and that's what I like about Judy Chu, is she listens to you. But I think she's getting huge pressure from some of these advocacy groups that say, don't do it. Do not cut that part of the bill out. So it'll be very interesting to see what happens down the road when it comes time to actually draft the legislation. Because one of our positions was that we think that there ought to be cities involved with the drafting of any legislation, so that we can work out some of the details that are impacting us, instead of somebody else doing that work for us and us not knowing anything about it. So I think there's a lot still up in the air, and we've been to a lot of meetings. I don't know what this meeting's about today, but I'll tell you, meeting after meeting on this particular issue, and there are so many stakeholders, and there are so many groups saying, I really think that we need to study this more, and then there are other groups that are just saying, push forward, Judy, with it, just move it forward. And I think it's a difficult situation for us and for her on this legislation.
Very difficult.
So,
No question about it.
the second thing, I'll just mention this part of the political side of this, is, you know, we bring up AB 109 all the time and the issues that are involved with that. That's the realignment of our prisons, throwing people into our particular area. I had the opportunity to actually ride along with one of these groups, law enforcement people, that are charged with checking up on these people. And it's really kind of scary. This is a group that's made up of police officers from Covina, Glendora, Laverne, Pomona, Claremont, and they have a huge area, and they got 7 people to do this. And just riding with them and going from one spot to the other, number one, very few people that are being released actually live where they say they live, because that's what they're supposed to validate, whether that compliance or if they're doing any drugs or hanging around with the wrong people. The second part of it is that they're running across some really bad characters out there that have been released out of this. And I'll tell you, one of the things was, it's an amazing story. They're driving down the street, and they have all got unmarked cars, but they're dressed out. You can tell they're dressed out in battle gear. I've never seen so much equipment on people, because the wording that they used with me and what I actually saw out there is that this is like the Wild West out here. When you go up to these houses, 60% of these people run. You got to chase them down. You don't know what you're dealing with once you get to them. They hide. They do everything they can do to get away from you. They said they were driving down the street in a car. There's 4 officers in the car. Because when they go out on these sweeps, this is so bad, they take 7 officers because of what they could possibly run into. And so, because they have to, number one, deploy the officers back of the house, okay, to make sure that they're not jumping out of windows, which they do. And they did that while I was with them on this day, and it was amazing. Then they have to go to knock on the front door. They don't know what they're dealing with. when they open the door. And so it takes that much just to secure the area. And so they're driving down the street, and they see this guy in a car next to him. And he looks like a bad guy. One of the guys recognizes the guy, so he thinks, what's he doing out here? And so he shines a flashlight at this guy. This guy turns around, flips him off, and then slams on the brakes and starts following the officers, okay, in their car. Because I guess he doesn't know they're officers. But anyway, he's following them, and they finally pull over to the side, get behind him. They get into a big pursuit when they finally use their lights to stop him. It's a huge pursuit. They finally get this guy because he crashes. When they get up to the car, this guy's got a murder rap history. And the last crime he was, this whole process, the way they get released is on their last conviction. It can be a misdemeanor. You can be the worst character in the world, the worst gangbanger, the worst criminal in the world, but they will release you if in fact your last arrest was a low risk, low violence type of a situation, and non-sexual, okay? But the truth of the matter is that there's nothing, there's no going back and saying, hey, wait a minute, this guy's got a homicide, and he's a killer in his background, so we really shouldn't release him. There's none of that. So they get this guy pulled over, they find out he's got that kind of a rap sheet on him, and they also find a loaded MAC-10 on the seat next to him in the car. And this guy's ready to fight. I mean, he's a hardcore criminal. And he says, we're running into those people all the time out here. And it's scary what these officers have to put up with. I rode with them for 8 hours. They made 8 checks. They made 6 arrests just in that period of time. And they ran into people that have gun violations on them. They run them with drugs, heavy drugs violation. They run into one guy had a manslaughter rap just on the as part of his rap sheet. And so the only reason I mention that is because one of our biggest positions is you need to check these people. You need to go back and check their criminal history and their mental health history before you release them to our community. So what we did is the mayor of Covina, Walt Allen, him and I used to work narcotics many years ago when we were younger guys, okay? And it's kind of interesting. We say, well, we both work narcotics, and how the hell did we become mayors? You know, that's a weird situation. But nonetheless, we've been working with the California police chiefs and the League of California Cities. And the whole push of this effort was to bring before the League of California Cities that represent 400 and some cities a resolution that basically said you need to meet with the governor, representatives of the league, and representatives of the police chiefs, and they're both willing to do that, and talk to them about the impact that this law is having on communities and frontline law enforcement. So we were able to come. We got endorsements from both of them, but then we went to the league meeting 2 weeks ago, and you have to go through a process, 3 different committees, and then you go to the General Assembly of Delegates, which is about 300 representatives from 300 different people, 300 different cities, and we had 8 issues. I'll just run them by you real quick. Number 1, it needs to be fully funded. You can't just put enough money on this to do a half-assed job. It needs to be fully funded so that the job is done right on there. Secondly, that they need to amend that 109 change for the reason of releasing people so that you take into consideration their history instead of just their final conviction. There needs to be a uniform recidivism with the input of all criminal justice stakeholders. There is no recidivism model. If you live in Northern California, you have one model that says this is a recidivism guy. If you live in LA County, you got another one. So there needs to be a consistent one throughout the state up there. There needs to be some modification to the oversight committee that is responsible for distributing the AB 109 money. Because here in LA County, what's going on is that the state of California gives the county $500,000 or more, $500 million or more to run their AB 9 effort. Well, in some counties, they share that with the local cities, some of the cities. In our particular county, the board is made up of 7 people. 6 of them are county advocates, and 1 of them is a police chief. So what happens is that cities get vetoed every time, and I was at a meeting of the Criminal Justice Committee in LA, and the lady from the county was saying, the finance lady was saying, okay, we're gonna get so $580 million from the state, and I asked her, well, how much money is our city's going to get of that? And she looked at me like I was a foreigner, you know, like I just fell out of the sky, and she says, you guys aren't gonna get any of it. And we thought, well, great, we're the frontline law enforcement, why aren't we getting part of that? And the reason is because of the makeup of the committee, and it's one of these little things that's left out of all this legislation, they can veto it, any of your efforts. The Little Hoover Commission did a report, they made recommendations, very good recommendations, we just attached that and says you need to do everything these people say, because it's very important. And data sharing. There's no way to share data. Right now, LA County is starting to do a good job with it because the county itself is putting together all these different systems. But the reality is, there's no data sharing between LA County and San Francisco County. It's like you're in different domains. There is none, and our position was there needs to be a uniform reporting system on these people so we know where they're at, what they're doing, if they've been arrested, if they're on parole again, or if they're been convicted again. We need to know that, and it needs to be known up and down the state uniformly. So we presented that to them at this meeting, and remarkably, when it came to the vote, all 280-some delegates voted in favor of it. And so it passed overwhelmingly. No, not one negative vote, because every state, every city in this state, and every county in this state is similar, is going through similar problems. Not as bad as LA County, because we have 1/3 of these offenders here, okay? But all the way throughout the state, they're just, it's a plan without a plan is what happened with this. There's no planning that went into it. It was just, let's just do this and worry about it. And when we talk about healthcare, it's the same concept. Let's just do it and work out the details later. Well, heck, it's 2 years later, and there's a 72% recidivism rate on these people. So what do you accomplish?
Yeah, but the healthcare's not out trying to kill the general community.
Yeah.
It's a little worse, I think.
Yeah, but it's just the idea.
It's
of how
the
it works.
detail.
That's
Anyways,
really need a plan.
So I guess they'll be forming a committee to meet with the governor to try and get his ear to talk about maybe providing more concern to cities in that. Other than that, there's a whole bunch of legislation that's coming out on behalf of the league. Some of it the governor's signing that the league has approved, a lot of it actually, and some of it he's not signing. And I guess we'll know better in a couple of weeks exactly where everything is at. So very important legislation, some of it, it's very scary, some of it. So anyways, that's my long report.
We have a mayor with some passion.
Sorry.
An issue, and that is good. That is good. You're involved in that, and I applaud you. And I applaud Judy Nelson because she's been staying involved with the water issues and the water permit that is being battered around and.
MS4.
Yeah, and we just gotta stay on top of that because if we don't, it's gonna cost us more than we can afford. Joe?
It's so timely that the mayor would bring this up. On the corner of the counter there, I brought an overview of AB 109. What he said is just spot on. I have a unique perspective because I'm a former police officer, and recently I was appointed a commissioner to the Los Angeles County Department of Probation. So as you can imagine, this issue's been at the forefront of our agenda every month when we meet. And so I'm very concerned about this issue, and if you want to get an overview of just what the mayor and I talk about, it's in that paper there, so feel free to pick one up.
Great, thank you, appreciate that. Valerie, I skipped over you, you got anything?
You know what, I was going to go over our marketing efforts. We did do a brochure, but I think given the time, maybe we can do it next.
We'll do it next
meeting.
time.
Yes.
Okay, great, we'll do that. Citrus?
I just wanted to announce saluting our veterans. I have some flyers if anyone wants one. It unfortunately conflicts with this meeting,
It's just-
but it is co-sponsored by the city of Glendora, the city of Azusa, Azusa Pacific University, and Citrus College. So, yeah.
What do we do, what wrench do we throw in the works? Because we have this conflict every November with Veterans Day activities and our meeting. Do we throw a big wrench in if we move our meeting to the second week in November?
The second week in November is the chamber luncheon, and the week before is Halloween.
The chamber luncheon?
The chamber luncheon is on Thursday, the 14th, the
Oh,
second.
okay.
It just
What kind
happens
of
to
candy
be,
do they have here?
I will bring my bag. The village could shut down.
Well,
That's right.
we'll take a look at that to see if we can keep from conflicting, because it comes up every November. We have that. I remind you that we have an election in our city for school board. We need to make sure that we're citizens. We figure out there are 4 candidates for 3 positions. And we need to figure that out and make sure we get out and vote. Our school system is important to us and important to the people that look at Glendora as a place to live and bring their business. And so make sure that we get out and vote. We are over our time. We're going to think in terms of 1:30 rather than 1 o'clock because we have good reports. Anybody that has something that's just got to fire up. I appreciate very much Alexis being here, standing in for Fawn and for the opportunity to be here. Thank you again for presenting, and we'll see you in a month.